Exercise is really important post-stroke. At PhysioFunction, we think of exercise as one part of what we call the rehabilitation triad. There's exercise, there's the hands-on one-to-one therapy, and there's also the use of technology. What happens after you see your therapist and go home is where your exercise comes into play. It's not just about the hour you spend with your physio on a one-to-one basis, it's going away and doing the exercises that your physio gives you. By giving a home exercise program to a client, I'm looking to improve their strength, their endurance and their flexibility with the overall aim of improving how much physical activity they can do on a daily basis, for example, sitting to standing or walking. After you've had a stroke or some other neurological event, you may well have some weakness in your muscles. Your physiotherapist may devise a specific exercise program aimed at strengthening those muscles groups in order to get them as strong as possible. Post-stroke, as well as having a degree of muscle weakness, you may well have a degree of muscle tightness and inflexibility. This is because after a stroke, the muscles can actually find it quite hard to switch off and stop working, and over time they can become quite tight and inflexible. That can actually cause problems with regards to tasks such as walking. For example, if your calf muscle was to become tight, you may well have difficulty lifting your foot up when you're walking, and that might lead you to trip and fall over. Your physiotherapist may set you up with a stretching program to try and help with that alongside your strengthening exercises. After you've had a stroke, you may find that certain tasks are more difficult than before you had a stroke. You may find that you're becoming more tired a lot quicker than you did before. This is because not only you've been unwell, you've been in hospital and have general deconditioning, there's also the associated muscle weakness as well. The end result is certain tasks such as sit to stand or walking are a lot harder than they were before. In order to address that, your physiotherapist may suggest gradually increasing how much physical activity you do on a daily basis. For example, that may mean walking slightly further or increasing the number of repetitions that you're doing of your exercises. The overall aim of exercising post-stroke is actually to improve what you can do physical activity-wise on a daily basis. However, your physiotherapist may actually set you a number of functional tasks to try and help address this. For example, standing and doing the washing up. We'll look at your balance and your arm, but it's also functional tasks that you can do every day. They may also include sit to stands or doing the stairs a number of times. Again, it's an exercise, but it's also looking at a functional task for you. Those clients that are slightly more high level, you may want to think about going to the gym. As physiotherapists, we can assist you with that. We can go to the gym with you. We can set you up with an exercise program designed specifically to strengthen up those muscle groups that are weak. At PhysioFunction, we also run NeuroFit classes. These are classes which are designed specifically for clients who have got a neurological condition where they can come and exercise safely in a group environment.